Hi, I'm Emma Weitzel and I did my presentation on hearing loss, more specifically tinnitus. And what is tinnitus? Tinnitus is a perception of sound that does not have an external source, which means other people cannot hear it, and it can be heard as ringing, roaring, buzzing, or etc. And tinnitus is not a disease in itself, it's a symptom of another disease or hearing loss, which is the most common. And testing that can be done to figure out the source of your tinnitus is a hearing exam, which will compare your hearing to somebody else of your age, which can determine if your hearing is below average. And lab tests will help determine if your tinnitus is caused by anemia, thyroid dysfunction, heart disease, or vitamin deficiency. And you can get imaging like a CT or an MRI, which will thoroughly investigate the inner ear portion, whether if that's the problem or the cause of your tinnitus. And your doctor may ask you to move, and if your tinnitus worsens with movement, it could be a sign of an underlying condition. And treatment that can help ease the tinnitus can be earwax removal, which will remove the blockage and help lessen the tinnitus. And you can treat an inner ear condition, which may require surgery, medication, or another treatment that will also help the tinnitus. Hearing aids can also help tinnitus if it is noise-induced or hearing loss related, and they can help reduce the tinnitus by providing the noise that your brain was trying to make up for. And changing your medication can also help, because if your tinnitus is proven to be because of your medication, you can either switch your medication or stop the use, so that can lessen your tinnitus. Management recommendations are background noise that you can play so that when at night or when you're trying to focus, you're less focused on your tinnitus. They also make masking devices, which is similar to hearing aids, that can provide a continuous low-pitched white noise that helps suppress tinnitus. The different sounds in their meetings, it's not limited to clicking or the rest of these, but clicking can be caused by muscle contractions within the ear or on the outside of the ear. Pulsing, rushing, or humming sound can be caused by vascular causes like abnormal blood vessels, or high blood pressure, or exercising or laying down in the motion of standing up can also cause a rushing noise. And low-pitched ringing can be caused by an ear canal blockage, Meniere's disease, or stiff inner ear bone. High-pitched ringing is the most common sound being heard that can be caused by loud noise exposure or hearing loss, different medications that are causing your tinnitus, or acoustic neuroma. And how tinnitus affects me is I have high-pitched ringing tinnitus, which is caused by genetic hearing loss. And I frequently use background noises to help suppress my tinnitus, which I feel that helps me at night and when I'm trying to focus. My treatment will be hearing aids in the near future. So my brain is trying to make up for the hearing that I cannot hear. So when I get hearing aids, I'll be able to hear the noises and my tinnitus will be reduced. I started noticing at a young age, so between the ages of 5 and 8, I started noticing it, and we went to CMU to get testing done, and that's when I was diagnosed with tinnitus.